producing this report. And our team, our strategic planning and research team, does not just put together a bunch of numbers. We have an elite team of researchers who deeply investigate issues every year. And obviously every year we're going to look at the socioeconomic well-being of our residents, but their keen eyes are able to identify specific trends of note. And so we're going to dig into that today. But we've seen rapidly changing times right now. You cannot wake up without text alerts, new tweets, new headlines, all of that. So much is changing. And you have to be able to respond to that. And right now in our city, in our state, in our country, in our organizations, leadership is so critical. And we will not be able to survive these times, or have been able in the past, without someone who has resolve, fortitude, and exemplary vision to bring their team through, bring their constituents through, bring their clients through, bring their city and their state through. And with that being said, I'd like to invite up the Executive Director of Metro Social Services, Renee Pratt.
Good morning. I am so excited to say good morning and welcome to the 16th Annual Community Needs Evaluation. I am just so excited today. In the past few years when we've had the release, our staff, meaning the social services staff, weren't able to attend this event. And today I'm proud to say that we closed our doors and brought staff in to this important event. So thank you all for being here, and thank you for all the work you all do as well. Also like to acknowledge our elected officials who are with us today. Many attend on an annual basis and probably hasn't missed a CNE since the exception one, okay? So again, thank you so much for being here as well. Also, before I bring up the mayor, I would like to say I just truly appreciate the mayor of this city. Everything that we've gone through in the past 2 weeks and his response and his immediate response represents Nashville and what we're about, and that's solving problems and addressing issues, and he has definitely done that. So let's just say thank you for the mayor. And also the time that he's taken out of his schedule this morning shows that this is an important event and he is invested in our community needs evaluation. This mayor has just been a blessing to us. He's been at our events several times over the past year. I don't think he didn't miss one that we've invited him to, and I'm very thankful and appreciative of that as well. So without further ado, I'd like to bring up our Honorable Mayor of Nashville, Tennessee, Mayor Freddie O'Connell.
Well, thank you, Director Pratt, and just as it's been my honor to attend this event many times through the years, one of the things that has been both compelling and inspiring is seeing that this event draws people from across the spectrum of Nashville, that we see our nonprofit providers here with us, that we see public leaders here with us, and that we see even our Chamber of Commerce here with us, because we know that understanding our community needs helps us all operate the city more effectively for everyone in it. So good morning. And I want to thank Director Pratt for her leadership of Metro Social Services. As you all know, this department provides vital services to help Davidson County residents in need. It was created to be a helping hand for Nashville families that are struggling. Metro Social Services is the largest facilitator of home meal deliveries, facilitating up to 16,000 per month. But one of the most vital services is the annual report that we will be discussing today. This is the 16th year of the report, and I would say, having looked at all of the previous reports, it is as relevant to local governance today as it ever was, because it informs us about our need, which helps us refine our policies and programs that respond to that need as we go forward and do the work of governing every day. And this community needs evaluation is the work of many, many people. In addition to Director Pratt, I want to recognize the Metro Social Services Commission, lead researcher Dr. Garrett Harper, and the full team at MSS Planning and Research, as well as their director, Abdelghani Barre. So would you all help me thank the Metro Social Services team? And then, of course, public leadership is a part of this. I know there are many colleagues in public service with us today. I think I've seen council members Berkeley Allen and Bob Nash here already. I think we also were expecting council members Tom Druffel, Brenda Gadd, Courtney Johnston. I know I saw our assessor of property, Vivian Wilhoit, here, State Representative Harold Love, and then one of our key community partners is Hal Cato with the Community Foundation of Middle Tennessee. And then, of course, special welcome to our Metro Department leaders who joined this, our Metro workforce who are participating in their partners. Thank you all for your service and work on behalf of neighbors who need us the most. So can you all help us celebrate the public leaders in the room? Now, broadly speaking, and I say this having grown up here, Nashville has been an amazing success story that has unfolded around us over this entire century. For those of us who were born here and grew up here, I would say the changes have been nothing short of breathtaking. Half of our skyline has been built in the past decade. Visitors now spend $30 million here every day. We are building a new stadium and multiple new neighborhoods, but other things have changed too. The median home price in Nashville has risen to $500,000. This is more than 5 times greater than our statistical area's median income. A recent study by the Planning Department found that the median household incomes among our Black and Hispanic residents means that they cannot afford to buy homes in 99% of Nashville neighborhoods. And so the community needs evaluation is an important reminder that not all Nashvillians are benefiting as a part of our overall amazing success story. And this year, it reminds us particularly that there is a high cost to low wages in a way that leaves us all paying the bill. And some of those costs mean decreases in purchasing power for basic necessities in the home, higher health costs, not just for people who are struggling with health care access, but for the community as a whole. And worse, deeper debt, deeper poverty, and those things together leading to deeper inequalities. Right now, the living wage for one working adult with no children in Davidson County is $52,858 per year. That is about $23,000 more than the income ceiling for the bottom 20% of Nashville earners. That ceiling is less than $30,000. All of these points of data are embedded in this year's community needs evaluation, and a few more that are worth us all considering. More than 1 in 4 Nashville adults have debt in collection. 1 in 5 Nashville children don't have enough to eat. They are lacking food security. 64% of our Black students in Nashville attend schools with high poverty rates, which is double the percentage for our white students. And more than half of our renters spend 30% or more of their income on rent, which means that their housing is not affordable. Now, I will tell you, I knew many of these things from my service on the Metro Council representing District 19, which was a part of the city that existed in extremes. We had the largest acreage for public housing in the city, and we also had some of the highest cost per square foot housing in the city. And so they were a part of motivating my thoughts about running for this office a few years ago, because I was focused when I took office in 2015 on how we could reduce the poverty rate in the part of the city that I was representing without it being a factor of displacement. And so I remain driven by a focus on affordability and quality of life, and ultimately a better Nashville for Nashvillians. We have known for quite some time that housing and transportation are the top 2 expenses in most households. And in our first year, with support from 2 out of 3 Nashville voters, we passed Choose How You Move together, a generational transit improvement program that will bring more access and affordability to our residents. We have funded and started the first 11 projects there beginning July 6th. WeGo, our local transit authority, is increasing the service frequency of several routes. They are expanding this year WeGo Access, which is a service for riders with disabilities, including weekends for the first time, and later this year we will launch, for the first time ever, a low-income fare program. We've also taken other big steps forward on housing affordability on the East Bank. As we got started, our master development agreement locks in a century of affordable housing on Metro-owned property. We have leveraged the Barnes Housing Trust Fund, named for the Reverend Bill Barnes, to create and preserve over 1,300 affordable homes in just 2024. We launched a Catalyst Fund, a new partnership fund to Barnes to offer fast, flexible loans to preserve affordable rentals that would otherwise be lost to market prices. We're also working quickly to absorb new information we have about the combination of faith-based, academic, and healthcare institutions that have land that can join with metros and can partner with us in funding. And we have now Clark United Methodist first affordable housing project that we've already cut the ribbon on. The Northview Housing Development for Seniors is a partnership with Born Again Church. And in my own neighborhood, in Spiritus, a Lutheran-led organization, reclaimed and reinvented one of their properties to offer new affordable housing for seniors and people living with disabilities. In our recommended budget that we just presented at the State of Metro and have shared with the Metro Council, we've recommended a commitment of $45 million to implement our first year of a unified housing strategy that we just received that will give us a decade's worth of toolkits to bend that cost of housing down. But the subject of this year's community needs evaluation is wages. And Metro can't easily impact private sector wages. But even in a responsible budget, we are pushing on better wages for Metro employees across the board. Our Human Resource Department monitors the MIT Living Wage Calculator for living wage guidance and uses a 3-year trend of previous calendar years to determine the recommended minimum hourly rate for full-time jobs in our pay plan. The proposed minimum hourly rate for fiscal year 2026 increases from $20 per hour, which I knew we needed to get above the $20 per hour mark last year. We're moving that up to $21.44 per hour, which exceeds the 3-year average in that living wage calculator. And these changes also reflect recommendations of independent experts at Mercer Consulting, which is a national leader in compensation consulting. It had been more than a decade since Metro had last engaged outside compensation experts. And as always, our goals when recommending pay plans are to design plans that are fair and equitable, allow us to recruit and retain skilled employees, and remain fiscally responsible so they can be funded year over year. We think we've gotten there this year. Metro has provided robust pay growth and increased employee pay by 30% over the last 4 years alone, recognizing that inflation and cost of living increases were right here in Nashville. These pay plans allow us as a government to continue our investment in our employees now and provide sustainable competitive pay growth in the future. But we're also working as a government to offset costs. In addition to the transit and housing scenarios I've already mentioned, we have a stronger property tax freeze and relief program thanks to the leadership of Representative Love and others at the state that meant you can now, if you are 65 years or up, contact the trustee's office and participate. Trustee Erica Gilmore just released participation numbers, and we have seen more and more people be able to take advantage of this program, and they are. We have a strengthened financial empowerment center that now has more of a focus on seniors as we calculate the millions of dollars in available benefits people aren't currently using that they can use to help further offset costs. There will be more news to come on that in the weeks ahead. And of course, our Metro Social Services team is working hard every day on the multiple programs that they offer. Programs like curbside trash assistance for seniors, senior welfare calls, which are daily check-ins with senior clients. And these began as responses to data in our community needs evaluation. Understanding these needs helps us improve our response. It's a big reason that I've been attending this event in person for more than a decade. The things that we know are in this evaluation help us keep getting better. But like so much of our work, responding on the topic of wages will require a network of partners larger than Metro. So we will be working to share this evaluation broadly to make sure that people understand the high cost of low wages. Now, as we thank our Metro Social Services team and we think about the importance of this work, I do want to take a moment of privilege to recognize one MSS team member in particular. Abdelghani Barre is the director of the Strategic Planning and Research Team at Metro Social Services, and I am sad and sorry to report for us, although I'm sure he is excited, this is his last Community Needs Evaluation report. AB is retiring after 31 years of service, and I would like, I'd like to invite Director Pratt as well as AB to join us here at the front of the stage to say thank you, because his work, his decades of service and commitment to this city show up in this report, show up in how we best serve our most vulnerable residents. And AB, I just want to take a moment to personally say thank you. So I'm just really here to say thank you, our Metro Social Services team, the commission that offers them guidance, the city that supports their work in our budget. We know that we are charged with responding to these needs every day, and I will share with you that as mayor, it is our full intention to do our best to respond not just to this year's evaluation, but to continue through the themes of recent years. To continue building a better Nashville for Nashvillians. It is an honor to have been with you this morning. Thank you so much. Director Pratt, thank you.
Thank you so much, Mayor O'Connell, and again, congratulations to you, Abdelghani, and we thank you again for your leadership, your foresight, your vision, and all the work that you've done. A couple of quick housekeeping notes. You all should have this in your program. This is a trustee survey. We are asking that you please fill this out and leave it in your seat for collection before leaving. Please do not forget to do that. Also, someone has reported a missing cell phone. That someone may or may not be me. So if you see a cell phone with a clear case on it, please take it to our registration table. It is a government phone. You are in the house of the Lord, so please do not feel inclined to leave with it. Thank you very much. I appreciate it. Also, there are two gentlemen in here, or maybe not. Just know, Willie, if you could wave your hand. That is Willie over there. Robert, if you could wave your hand in the back. These two gentlemen will have note cards that they'll be handing out, because once we get to our panel discussion, you will be able to either come to the mic to ask your question, or you can write your question down and hand it in. So go ahead and get your wheels turning in case you have a question, and we will get note cards to you. Just give a little wave and they will get those note cards over to you. Without further ado, the moment you have come here for, it is the overview, the unpacking of the long-awaited community needs evaluation. And to help us do that is a man who has more doctorates than I do, purses, shoes, and hair pieces, honey. This man is educated. He knows his stuff. Dr. Garrett Harper, please come unpack the report.
Thank you, and welcome to the presentation of the latest Community Needs Evaluation. This year, the theme of the data and the research reflect an important aspect of the local economy, the high cost of low wages. For the past 16 years, Metropolitan Social Services has compiled data, analysis, and research that provides information and insight on the social and economic well-being of the population of Davidson County. In recent years, these themes have formed a sequence that responded to local, state, and national context of the well-being of Nashville residents. We've considered the importance of well-being as a concept by itself, the role of the big squeeze, whereby Nashvillians experience difficulty in making ends meet in their household budgets. We looked at the cost and challenge of aging in Nashville. Last year, we provided analysis on the relationship between development patterns and economic well-being of the population. The next and critical topic is the earning profile of Nashville workers. Specifically, what gaps, issues, and challenges occur across the labor market relative to economic well-being. We'll do two things in the presentation. First, a brief profile of key aspects of the labor market. That will offer a backdrop to how the economy is structured. And second, we will look at the high-cost impacts of low wages on workers, on their families, and on society overall. First, a couple of definitions that direct our analysis on this topic. The living wage. This is a metric developed over 20 years ago at MIT to better address quantifying the local wage rate that a full-time worker would need to cover the costs of his or her family's basic needs in the particular community where they live. It's a means to show whether a worker's and a family's earning meet or exceed that living wage, or whether earnings fall short of that. Thus, it very much addresses what is meant by being in or not in a situation of poverty. Poverty, however, as a term and concept can be misunderstood. The poverty rate and poverty measures are a set of income thresholds used by the federal government to assess those living in poverty. Yet many consider those guidelines antiquated, outmoded, and overly simplistic in relation to the lived experience of the population. The official poverty measures were developed informally at first by the U.S. Department of Agriculture. This calculation was to take the food budget of a family in the early 1960s and to multiply that by 3. That was it. This logic was and is applied across the nation. The same measures for who is and is not living in poverty is the same across the 48 continental United States. Whether it's New York City or Nashville or the most rural counties in the nation, regardless of how costly it may be to live in those places. Regular updates on the basis of inflation have kept this simplistic way of assessing poverty alive to this very day. The MIT living wage calculation for Davidson County illustrates more completely what is needed for individuals and families of different composition. The full data incorporates specific current requirements for food, child care, medical care, housing, transportation, technology, and civic involvement tailored to the different family compositions. Here, one adult in Davidson County currently requires $52,850 a year as a full-time worker to meet basic living needs. With one child, that adult would require earnings of $82,000 a year, and with 2 children, that rises to $99,000. As the household and family look different, so will the required earnings. For a household where there are 2 adults and only one works, these are the requirements for earnings ranging from $70,000 to $90,000. Note that configurations of child care responsibilities factor in as an offset to those costs here. Lastly, a household where 2 adults are working would also have a different set of earning needs. Here, those income requirements range from $70,000 to $109,000, depending on the number of children. By way of contrast, these are the federal poverty guidelines that apply in Davidson County. These are the same guidelines that are used in every county in the country. According to the federal guidelines, a single person with no children would be considered to live below poverty if he or she earns less than $15,650. Any level of income higher than that would place the person to be above the poverty level. The lack of coherence of metrics that bear little resemblance to the lived reality in a place here is stark. A person with an annual income of $16,000 in Davidson County would not have enough money to even pay current average apartment rent, much less have anything further on hand for survival needs of food, clothing, or anything. In fact, 3 times the poverty threshold, or 300% of poverty for one person, does not equal the living wage required for one adult worker. To just carry that idea a little further, the federal poverty guidelines as apply in Davidson County state that a family of 8 persons would require only over $54,150 to not be living in a poverty situation. We'll just dwell on that for a moment. A family of 8 could live on $55,000 a year in Davidson County and be considered above the federal poverty threshold. The troubling aspects of this are several. One of those is that these are the measures that drive an annual reflection on whether a community's poverty rate has gone up or has gone down. Currently, the poverty rate in Davidson County is about 12%. But what is being measured is a reflection of metrics that do not conform to the reality of living in the community. The question then must be, is it not more useful, meaningful, and appropriate to ask how many persons are living above or below a wage that is a living wage, reflecting the actual cost of living, the actual composition of families, and the actual differences between one county and the other 3,000 counties in the U.S. Assuming that the living wage calculation provides a more useful and correct answer to who is poor, in poverty, and struggling, we can see then what the labor market looks like in those terms. Within the Nashville area, the region, one can turn to the U.S. Bureau of Labor Statistics and see where are the occupations with the largest number of workers. When we consider the 25 largest occupations in the Nashville area, it turns out that 20 of those have median earnings that are lower than the living wage for one adult in Davidson County. Just one additional definition in thinking about these data points. We all recognize that median refers to the middle, but it's easy to think about a particular occupation and its median wage as if all or many of the persons in that job are earning that wage. In fact, we know instead that it tells us that exactly half are earning less than that wage. So we see a table with many words and numbers. Simply, however, these are the 20 of the occupations in the Nashville area with the most workers. These 20 all have annual earnings that are less than the living wage for one adult in Davidson County. All of these occupations have many thousands or tens of thousands of workers each. For instance, while there are 590 dentists in the Nashville area, not on this list, there are 37,000 laborers and freight movers. While there are 560 electrical engineers in our region, there are 28,000 retail salespersons. Put simply, Nashville and most any community will have far more of the jobs shown on this list than they will the individual occupations that sometimes and often have higher earnings. The large pool of jobs with large number of workers, typically paying low wages, form the critical mass of the workforce of most cities. The other reality here is that while education and training for persons to advance to new, better paying careers is important and is necessary, these jobs with these large numbers of workers still require workers, and workers at the pay levels that are shown here. Just a couple of examples out of this large set in the table. In the Nashville area, there are nearly 20,000 cashiers. The median wage for that job in this market is $29,900 a year. Half of the cashiers in this area earn less than $29,900. One more example, there are about 10,000 janitors and cleaners in the Nashville area. Half of them earn less than the wage shown here, $34,930. It also becomes clear that if there are two adult earners in a household in some combination of the occupations shown on this list, the sum of those two incomes in most cases will not reach the living wage, particularly if there are children in the household. From that long list of 20 largest occupations in our area, there is a grand total of 326,000 workers just from those 20 occupations. In short, Nashville, as most cities, has many, many low-wage jobs that outnumber many other occupations that require more skill and have greater earnings. And these are only the top 20. It is through these types of data that it becomes clearer that approximately half of the workers in Nashville and the Nashville area, as in many cities, experience living wage poverty. With this profile, we now look at the high cost that comes from low wages. The high cost to workers themselves, the high cost to their families, and the high cost to society as a whole. Workers in these types of jobs experience a variety of costs, some more obvious than others. Workers in low-wage jobs experience a variety of specific adverse health impacts. 16% in the earnings categories we just saw lack health insurance in Nashville. Research shows that low-wage work can be considered an occupational health hazard, one where workers experience higher levels of cognitive decline, higher BMI, and higher rates of hypertension. A study by the Journal of the American Medical Association found that workers with sustained low wages were 38% more likely to die in the course of a 12-year study period. Many low-wage workers experience unstable hours and shifts, and many take on a number of low-wage jobs simultaneously to make ends meet. In 2025, over 9 million Americans worked multiple jobs, and that's the highest rate in 15 years. Multiple job holders are typically not in high-earning positions. Rather, they are concentrated in healthcare, hospitality, food services, and retail sectors. Often, low-wage workers find it difficult to afford to live near their job. In Nashville, only 37% of jobs are within 10 miles of workers' homes, and the median commute distance is 11 miles. We recognize that Nashville is a very car-oriented city. Average weekday mileage is over 40 miles. The map in the center, provided to us with our partner, Dr. Wansu M. at Meharry Medical College, this shows the percent of workers that used public transportation in recent census data reports. These patterns and others found in the full Community Needs Evaluation report provide opportunities to see not only where workers live and work, but where there are areas where there are large numbers of workers living who are in particular occupational groups. Low-wage workers bear high costs to health, unstable work, and long commutes. Their families also bear many high costs. Low wages inherently imply that there is little opportunity for families to save. For many years, the Federal Reserve System has surveyed Americans about the amount of emergency cash that those families would have on hand. Typically, as in the most recent survey data, 37% of adults would have to borrow money or sell something if they needed to come up with just $400 in cash. The day-to-day and week-to-week experience of low-wage families is prone to unexpected expenses, accumulating debt, facing rapid increases in costs such as housing and groceries, often weak access to banking, and typically family and friends that are simply struggling in the same way that they are, unable to offer loans or financial help to one another. 2 years ago, the subject of the community needs evaluation was the cost and challenge of aging in Nashville. That issue remains as vital as ever. By 2030, over 30 million Americans will turn 65 from this year forward. The median retirement savings in our country is $225,000. Persons in low-wage jobs simply are unable to save in meaningful ways for a distant or a near-term retirement. Some notable differences exist by sex, race, and education levels. The average retirement savings for those with a high school degree is $75,000. For those with less than high school, savings for retirement is $7,000. In short, many are likely to deplete whatever savings they have long before their expenses stop. Many low-wage earners of necessity have become highly dependent on Social Security for their very survival. Hunger and food insecurity are very real daily parts of the lives of many Nashvillians. About 1 in 5 Nashville children does not have enough to eat. Low-wage earners, as others, struggle to afford groceries that have increased by 25% in 5 years. And then housing. A household is deemed to be cost-burdened when it spends more than 1/3 of its income on housing. Certainly high-income households may choose to pay large shares of their income for housing because there's plenty of money left over for other needs. But these data and these maps control for income. Here on the left, we see that there are 52,000 households in Davidson County with incomes under $50,000, certainly low wage and below the living wage, that do pay more than 1/3 of their income for rent. And the map shows the distribution. On the right, we see over 15,000 homeowners that have incomes under $50,000 and pay more than 1/3 of their income for their mortgage costs. And these patterns by council district show where there are higher concentrations of both groups. For households with children, low wages become a steep barrier to making ends meet. Toddler and infant care range between $9,000 and $11,000 a year. Infant care in Tennessee is more costly than in-state tuition at the state four-year colleges. Nashville households spend about double on child care expenses what the federal government says is affordable. In these situations, it may not be surprising that large numbers of American households, here over 100,000, are driven into poverty due to child care costs. And children growing up in living wage poverty families often experience hardships in their childhood and youth on through their adulthood. Children in low-wage households often experience worse health than other children. They have worse education outcomes, including higher dropout rates and fewer opportunities for education. A child in a low-income household may lack the environments and the role models that others have. In employment and economic terms, research shows that the experiences of poverty in younger years creates long-lasting effects on the positive side for those persons as adults. So families experience many hardships that are attached to low-wage jobs. Ironically, safety net programs themselves can trap workers in cycles of poverty. Incomes are already so low that adding even modest amounts of work and earnings can actually put those families in a worse situation in terms of being able to afford housing, food, and other necessities. Research has suggested that this benefits cliff, as it's known, is the single greatest barrier to self-sufficiency for low-income, low-wage families in the U.S. Workers experience costs for their low-wage jobs. Families further see other challenges. But what about society as a whole? In what ways may we all, as a society, pay a price for the widespread prevalence of low-wage jobs in Nashville as in other communities? Workers themselves are caught in traps of unstable work, inability to participate in a wider consumer society. But business bears a cost as well. Research suggests that business may fail to recognize their own high turnover costs and productivity losses that are related to low-wage jobs. The bottom line of business may be impacted in numerous ways through sustained instability by reliance on low-wage workforce. The broader economy of a city can be impacted by large numbers of low-wage workers. Tax revenues are lower than they might otherwise be. Continuous rise in the standard of living would mean greater economic well-being for all persons in the community. Perpetual reliance on public assistance is one way that everyone pays the price for low wages. Wages that are low often remain stagnant. The federal minimum wage of $7.25 has not been raised in 16 years. Young workers entering the workforce will experience a minimum wage that has never increased in their lifetime. The real value of the U.S. federal minimum wage is the lowest it has been since 1956. Low-wage households simply can't spend much in their communities. They don't have the money. And housing, the largest single item in the household budget, becomes a hardship and a price that society as a whole tries to tackle. As children struggle in their education due to low-wage poverty, the education system struggles to overcome those difficult challenges. That struggle itself is a cost, a considerable cost, that the entire community must cover. In Metro Nashville Public Schools, a far lower share of economically disadvantaged graduates go on to college than their non-disadvantaged peers. This is a cycle of poverty in a microcosm. Low-wage jobs and low-wage poverty do have residual and long-lasting effects that are costly for everyone. With the high cost of healthcare services, many low-wage workers and their families choose to delay or forego medical care. Over half of persons in all categories of health insurance do so, typically those with lower earnings and an ability to pay. The result? Health problems get worse and the cost escalates. These costs then get absorbed into the health system in ways that impact everyone. Research indicates that poverty, living wage poverty, can be a factor in higher crime rates, increased vulnerability to violence, and even rates of incarceration. In terms of transportation impacts, the high cost of owning and operating a vehicle is difficult for low-wage workers. The choice then is to move to long distances from work to afford housing, which simply intensifies pressure on road networks and transportation systems. Again, a cost pressure for society, not to mention environmental damages. In reality, many low-wage workers in America simply must depend on the safety net to survive. About 70% of recipients of SNAP benefits and Medicaid or TennCare enrollees are working full-time. The low wages simply don't pay the bills. Disproportionately high shares of workers in certain industries work full-time but do not earn enough. Their living wage is only made possible, if you will, through a safety net that attempts to make up the difference to purchase food, medical care, and other essentials. There are a number of federal safety net programs that are critical to survival for many of the workers in jobs that were shown on those tables just a few minutes ago. Retail clerks, cashiers, janitors, laborers, others. Over 300,000 in just 20 occupations in the Nashville area. However, the safety net itself leaves many behind through meager thresholds tied to that 60-year-old poverty guideline. Then there is the benefits cliff, which acts as a catch-22 for low-wage workers and families that would strive to earn more. And then some choose to or fail to participate when they are eligible for a variety of reasons. The Urban Institute suggests that full funding and full participation in all of the 7 major safety net programs would reduce poverty by substantial amounts across all demographic groups in Tennessee. As in each previous community needs evaluation, we note that many of the issues and challenges are structural and not unique to Nashville. The same is true with data in this year's report. In each topic and report, however, we recognize that there is a context of any city within its respective state, region, and the nation. Here, the Center for American Progress notes that southern states have the lowest average participation and funding for many key safety net programs. At the same time, the southern region is the one with higher poverty rates, more food insecurity, lower wages, and incomes. The daunting challenges to structural inequities and problems can be daunting, but analysis and contextualization can provide insights. The high cost of low wages is felt by workers, by their families, and by cities and society overall. Reminders have come from many sources that society simply cannot look to charity, faith communities, and nonprofit agencies, however well-intended, to overcome the magnitude of the high costs that workers, families, and indirectly, we all pay. The quotes here speak to these ideas. We can't food bank our way out of hunger in the U.S. Every church, synagogue, and mosque is trying to help. Food charity has become normalized through a fraying social safety net. In the past, various research has said that charity can be no more than a Band-Aid. This report is offered not as a path replete with solutions to complex social and economic problems. Rather, the data, the analysis, and the context are provided as a means to perceive differently what may be blind spots or barriers to issues of economic hardship in Nashville and other communities. We invite your engagement with this analysis. Thank you for your engagement across the previous 15 years of the Community Needs Evaluation. Thank you.
Thank you so much, Dr. Garrett. Right now, we're going to take just a very quick 10-minute break, and then when we come back, we've got an amazing panel discussion. As a reminder, go ahead and start thinking of your questions if you have any. We're going to give you a note card to write those, or you can say it on the mic. But again, everyone enjoy a very quick break, and we'll be right back.